A very good afternoon to all the colleagues, friends, state officials, district officials, and functionaries from the hospitals, whether the doctor, nurses, whoever is somewhere the stakeholder in our efforts in building a system where the patients receive safe care. So in a series of the webinars, I'm privileged to welcome personally at my level, my personal, and rather our friend, Professor Arun Kumren Singh, who is at the moment, besides being the national advisor for the RBSK program. In fact, he is the one who started many initiatives for the young, the life which has just come to this world. Whether it was, I recall, started the SNCU concept, which later on came to be known as the Purulia model. All over the country, went beyond. And he started with RBSK, then creating a dedicated facility for the children at the district level, early intervention center, and many initiatives like different state governments. Though the state of West Bengal is his, the parent, he belongs to that parent state, but whether it is the state of Rajasthan, state of Bihar, state of Andhra Pradesh, where he happens to be the advisor to the chief minister. And besides, if there is any epidemic, when something goes wrong, like often we read in the newspapers that, okay, so-and-so thing happened, whether it was during the lychee harvesting at Muzaffarpur, or it is the quota incidents, we have always, or rather everybody has fallen back on such an eminent person. And what touches me most is his always a concern, always availability to address the issues and the health concerns of the common citizens. Like all of us at the National Health System Resource Center had been, whether it is in the middle of the night or during the day, had been contacting him during last 1.5 years plus, whenever somebody had the COVID. So his spectrum and the horizon is very wide. A teacher par excellence, and much beyond, even much above that, a very nice human being. I will not go into the details of his research papers because it will take me half of the session to read it out. But there is no journal in the field of neonatology or where community medicine or obstetrics and gynecology, which touches upon the care around the birth. Subsequently, he has not published an article nationally and internationally, original articles. So we have got such an eminent person to talk today with us, that what we can do in addressing the certain safety issues in building a safe system for our newborns who are very vulnerable. Like in quality standard, there is an explicit standard which talks about that how any facility which is taking care of their vulnerable patients. So in that context, now without much of ado, I would request Professor Arun Singh to start his presentation. Thank you, sir. Thank you for being with us.
Thank you very much. I must thank sir for such nice and kind words. First of all, let me congratulate all of you that you have had the patience on a Sunday afternoon, a desire. So the topic today is ensuring safe newborn care. And the usual thing when we talk of safety of newborn care, we imagine a big hospital, lot of tools, lot of machines, equipments, and all of them we think will ensure a safe newborn care. Today, deliberately, I'll be talking things which are closer to you, around you, and not the technical things of a hospital, because I feel in a big country like India, first of all, we should use our resources, which is around us. And for that, you don't need to go to a doctor, but you should have a concept safe. So when you say a safe newborn care, safety starts when? So first of all, I think all parents should read this beautiful poetry of the famous poet Khalil Gibran, who has written a poetry on children. And only one line which should be remembered for all if you want to raise your own child. And this session, I will dedicate it that you close your eyes and think you are going to help someone in your own family, because if that appeals, that will appeal to the bigger society. So Khalil Gibran says, they come through you, but are not from you. Every mother says, I have given you birth. I have given you my blood. You must listen to me. But see the beauty. Khalil Gibran says, your children are not your children. They are the sons and daughters of life longing for itself. So the birth of a child is not something that you went to the market and got it. You wanted to have a child, a life was to be born, both the moments clashed, and it was decided that the child will come through you, life will come through you. You may give them your love, but not your thoughts, for they have their own thoughts. Even if it is a newborn, all researchers have shown that even newborn have their own thoughts. You may house their bodies, but not their souls. So a mother may see that the child is within her body, within her womb, it is growing, it is using the nutrition, लेकिन वो मिट्टी की तरह है जहां पौधे को पनपना है. For their souls dwell in the house of. So with this, I think one should clearly remember, children do not move, think, or speak in a straight line. And neither does imagination or creativity. So Tagore had this problem going to school, because the schools, they teach you to walk in a straight line, think in a straight line. And he found that his imagination and creativity were becoming. So he decided not to go to the school, and that made him. Now, when we talk of the safety of newborn, let's meet 2-3 slides. What is a newborn? How is the human newborn different from the elephant's newborn, the giraffe newborn, the peacock newborn? How is it different? So for an elephant, the baby elephant, the newborn, the mother is worried about the weight. An elephant weighs 6,000 tons or some 60,000 kilos. The giraffe is worried about the height, because the giraffe neck is 22 feet, 6 feet, and the giraffe itself is 22 feet. The peacock is concerned about the beauty, because the peacock has far more colors than any human being can ever think of. So the human child cannot compete either in terms of weight or in terms of height or in terms of beauty. Then what does it have? It has a brain. So whenever we call safety, we are not only to make the survival, but to see that the quality of the brain, which is a potential to give something new to the world, should be preserved. And we have traveled this for millions of years. And if you see from Homo habilis, when the head circumference 500 cc to today, as a Homo sapiens, when we have 1500 cc, we have traveled the journey from a single cell to being a Homo sapien. And I have the photograph of Professor Stephen Hawking, who's no more, but all of you know that the world would care about his brain, though he could not even move a finger. So when I say safe, do we have a mechanism also to help the brain development during pregnancy? I would start with that a child is not formed with conception. A child comes before conception. So if you are wanting to have a healthy, safe newborn baby, you should focus on the preconception. And what are the two? Therefore, A is planning a pregnancy. Once you conceive, then the doctor is constrained. He cannot give you too many medicines. He cannot do too many tests. So this is very, very important. So avoid such substances which can be harmful, including the pollutants to your baby. Ensure a healthy lifestyle and plan regular health checkups. So if you have diabetes, you have hypertension, you must control it before you conceive. It starts right from preconception, then conception. Now, we should know that pollutants are very, very dangerous for the fetus. Neonatologist I am, it will be very difficult for me to correct what was avoidable. In India, apart from smoking and drinking, if you go to the rural India, you have this, wait a minute, we have the Manipuri tobacco, you have khaini, you have mothers using gutka or even pastes. And they don't think that these are dangerous because they are not smoking. So non-smoking tobacco is equally important. And I would think any kind. The other thing I would say, all vegetables, either you put it into a vinegar or wash it thoroughly, put it into a salt water to remove the pesticide, because pesticide can be dangerous. And the last thing is, you must know your blood pressure, you must know your blood sugar, you must screen for thalassemia, if nothing else, so that before you conceive, you know that the chances of a safe and healthy baby is there. You should also know about the diet, and the diet must contain huge amount of vitamins, minerals, iodine, calcium, and less of carbohydrates. So what does this mean to a common man? Common man doesn't eat by thinking about proteins. So the simple message is 10 to 12 glasses of water. So even if before you conceive and after you conceive, you have to keep it. And the second thing is, eat plenty of colorful fruits and green vegetables, whatever is available. The drumstick is so important. It contains so much of nutrients that you can do. And don't eat too much rice and wheat. Cereals should be less, more fruits, green vegetables, and of course, any form of protein. And the oil with which you cook, don't use one oil, mix the oils. So if you are using mustard oil and soybean oil, you should mix and cook it, because some constituents are missing in one, some will be in the other. So it's better to have this. So what am I going to tell you? I have divided my talk in these slides, the trajectory of having. So one is My next few slides will be based on these 7 messages. Avoid maternal stress, maintain oral hygiene, use the concept of flavor bridge, interact with fetus, avoid infection by washing hands, soaking all foods and green vegetables in hot saline water or white vinegar for 1 hour and then discarding this water. Avoid half-boiled eggs or raw eggs or partially cooked meats, and allow every pregnancy to complete 39 weeks and get blood sugar checked at multiple levels, even before the conception and also during conception. So the first thing is, this doesn't cost you a lot of money. In COVID know the importance of IL-6. How many of you know that all stresses cause increase in IL-6 and IL-1, which can cause a huge damage, especially to the fetus and the fetal brain. Because of the stress, the child will get less. There will be more oxidative stress and less brain maturation and neurogenesis. So one simple statement, don't quarrel with a pregnant woman, even if she makes a mistake. By just doing this, you would be avoiding 30% of preterm delivery. This is a cost to the system, cost to you as parents. For months together, you'll have to be in an NICU waiting before. So why go for the stress if you can avoid? And even if I make the child survive, there's a double the risk of behavioral problems. I think this message should go to all agencies where pregnant mothers work. I did this mistake when I was a professor to my female residents where they were carrying, and I was very stringent about their work. And sometimes I did give them stress. I regret it because this knowledge was not with me, that when you scold a woman, you're not scolding her, you're scolding the child in her. And this cortisol causes IUGR. Other thing which I would like to stress, something which has not been talked about much, is that both during preconception and conception and during antenatal period, getting teeth and gum checkup and an advice should become a part of the antenatal care and prenatal care. If this could be taken care, we could prevent preterm delivery, we could prevent the child getting caries, even the milk, and this would help the child's cognition also. So this is a huge study which has been shown that how pregnancy gingivitis, pregnancy granuloma. So what is the message? Just teach the mother to massage her gums morning and evening, and she should brush her teeth even without a paste. That itself will allow and prevent. And if there is a dental problem, she should consult the dentist before. Flavor bridge is a very interesting concept. Half of the mothers come to us and they say, our children don't like green vegetables. They like only pizza. They like only pastry. Is it genetic? Have we done something? And of course, that leads to obesity, that leads to problems. So is it a genetic problem, or is it something which we have created? So I think we have created, because during pregnancy and during lactation, whatever the mother eats, when the baby's brain is getting formed, the limbic system is getting formed, the baby gets this flavor and his limbic system becomes dependent. So if you are a Bengali woman and you are eating fish, the child all his life will be very much emotionally dependent on the fish, which should be a good. So you have to remember what to eat, because that has a correlation to the child, both during the pregnancy and during lactation. This message has two things. One is hyperthermia. So during the first trimester, if you have fever, please get it treated immediately. Even if you do not know the cause, at least take some antipyretic, take a bath, because fever itself is teratogenic, which means that आपके fetus को ये affect कर सकता है, उसके organ formation में affect कर सकता है. Some other message: mothers, when they cook, the fire is facing the belly. So during the first 3 months, they should avoid they should place the oven in such a way that if they have to cook, the heat should not come directly to the abdomen. They should not take a warm bath. This is already there. And those who are working in such which is like the furnace, etc., they should be laws to prevent that during the first trimester, they should not be exposed to this excessive heat. Now, this is photographs which I borrowed from Professor Stuart Campbell. These are real photographs of the child in the mother's womb, which you cannot see. And what this photograph depicts that the child has all the emotions, the fetus has all the emotions which the child has or adults have. That it can smile, it can cry, it can taste, it can see. Remember, there is a squint because fetuses, they don't have binocular vision and they also do thumb sucking. And parents get very much worried about thumb sucking. And I always say, please don't stop it. That's the way they console themselves. So what does it mean? That the mother during the second trimester should be asked to communicate with the child. There's just a curtain between the mother and the child. And it has been found that if the mother at a particular time claps her abdomen, and this is repeated day after day, the child will respond by hitting. So this is something, fetus reaches out to the mother's hand. These experiments have already been done if you do it. So the most important thing is that we were taught that term is 37 weeks. Now we unnecessarily overload our NICUs, SMCUs, because we think after 37 weeks, the baby is mature, we can do a cesarean section. I think this was challenged when people started understanding the brain. So between 35 and 37 weeks, there is still about 25% or 50% of the brain has to be formed between 34 and 40 weeks. So you are interrupting the brain formation. So why did they call it term as 37 weeks? That was based on lung maturity and not brain maturity. And this is a wonderful study which shows that if you see that the best mortality is between 39 to 41 weeks. It's a U-shaped curve. So at 37, 38 weeks, the still mortalities are high. So what is the message? If it is not a medical emergency, allow all pregnancies to continue till 39 weeks. And this is March of Dimes, which has come up with a very beautiful photographs that a baby is weighed at 35 weeks, only 2/3 of what it weighs 39 to 40 weeks, and allow it to be remain pregnant till 39 weeks. And had you done nothing, you didn't require much of times. If you allowed 100 women to go to delivery by themselves, majority would deliver between 39 to 41. That's the time when labor pain starts. So I think we messed it up by trying to make the term as 37 weeks. So what's the next concept? The next concept is, I think this we owe to Dr. Srivastava, sir, because for the first time he talked about that the delivery room has a direct relationship with the safety of the newborn. It's not only the safety of the mother, but the safety of the newborn. And here, I think traditionally, when home deliveries were done, all was done in one room, on one bed. And now you go to Europe, you find the same thing, labor, delivery, recovery. The moving stages of labor is very, very difficult to do it. By just doing this, you allow the natural pulsatile oxytocin to come and allow the child's bondage between mother and child and allow the brain's cognition of the newborn to be done. So you can ensure safety just by changing the design of the labor room, by giving what is called the respectful maternal care. That itself can change. Very, very important message. And here I would say having a birth companion, whosoever also does the same. Avoid induction or augmentation of labor. See, what is it? From the mother's womb to come out, it takes about 30 to 40 centimeters. And nature had thought to walk this distance in 24 hours. So the baby's brain constantly talks to the mother's brain and says, don't push me too hard. I want to travel this distance in 24 hours, 36 hours. Now, the problem with doctors is they think it's such a small distance. Why do I either cut open the abdomen and take out the child or just push the child? Either way, it hurts the child and can hurt the brain of the child. So a good obstetrician is one who can practice walking 40 centimeters in 24 hours. Zero separation. You don't separate the mother and the child. Immediately taking to the breast. Resuscitate with umbilical cord intact if required. Skin to skin contact with hammock and delayed dealing with empathy as shouting stops natural oxytocin. So these are the interventions. So initially I talked what are the interventions which could be done prior to birth. Now I am talking the intervention on the day of delivery, the place where delivery is there. Now, you see between 23 to 40 weeks, the newborn brain is maturing. So in 23 weeks, you see a very smooth brain. And at 40 weeks, you see huge amount of sulci and xyri. What is this sulci and xyri? So take a suitcase and pack too many things in it. And you'll get this 40-week sulci xyri, because all these things, somewhere they will be pushing out, some will be. So it's like a suitcase. And why this? Because you have packed too many neurons in it. How many? 100 billion neurons are packed in this brain. So 23-weeker, these neurons were not coming to the surface. By 40-weekers, they were coming to the surface. They were jostling with each other and this. So 100 billion neurons just means 100 times the size of the population of this country, and 250,000 neurons are formed per minute. So you can understand, if you quarrel for 1 minute with a pregnant woman, you are impacting 250,000 neurons. So you can still make your child a doctor. Maybe he had the potential to become a Nobel laureate. This was very important that in 1990s, we found that these rats, they are known as voles. They used to maintain a very close relationship after birth. They used to take extra care of their children, which was very special in these special rats. So the scientists cut the brain of this child, and they found that during labor, when the mother is shouting, there's a huge amount of oxytocin released. And this oxytocin not only contracts the uterus, not only contracts the myoepithelial cells in the breast to get milk, but it also has effect on the brain of both the mother and the child on the limbic system. So this was the new understanding. So it is very, very important. So when you do a C-section and there's no labor pain, this bonding doesn't take place. Huge amount of natural oxytocin, artificial oxytocin cannot cross the blood-brain barrier. Who starts the labor? Is it the mom, baby, or some doctor? And the best answer is the baby's brain speaks to the mother's brain. So when you do painless deliveries, you are actually stopping this communication, and there's more chance of birth asphyxia because the two brains cannot talk to each other. This is like a scuba diver. When the child is in the mother's womb, he is getting oxygen from the umbilical cord, that is at the umbilicus. When he'll be born, he'll get oxygen from the nose. There's going to be huge change. So what did nature do? Just like a scuba diver, when he's underwater, he has a tank and a tubing. So also the newborn, and he's getting oxygen there. When he's born, before his lungs open up, nature wants to give him time. So the nature said, I will continue to give you oxygen till you can get oxygen from the air, which usually takes time. So this is a wonderful mechanism. So don't do cord traction, don't pull out the placenta fast, don't cut the cord, because that's a support system, safety system, which the nature had built. And that is why you had such a long rope. Otherwise, we always say why nature gave this rope, because they can be caught around the neck. This is because it was supposed to give. And I did my experiments and found that it's not the artery, but the vein. So even if the artery pulsations are stopped, about 5 to 10 minutes, the blood may still be flowing. So the newborn will get about 100 ml of blood, will get more iron, will get more oxygen. Every moment in my research, I found that the child was getting 10% more oxygen if you had cut the cord after 1 minute. So if you have to move away from the moving stages of labor, the traditional way, one room with full privacy, where you could dim the light. So you have an Indian version of it. You have Indian companies which this bed can be converted into a sitting chair, can be a lying down, and you could deliver. No two mothers are going to share the same bed. India is not so poor as not to give space and privacy, because space and privacy actually would prevent cesarean sections, would prevent induction and augmentation, would prevent lesser birth asphyxiation children, would improve the cognition of the newborn. So I would say, so what is it I'm talking about? Research has been found that if the labor room is dark, there's more melatonin secretion, which stimulates the oxytocin, which stimulates the beta endorphin, which reduces the pain. But if there is fear, there's cold, you are made to lie down, there's more adrenaline secretion, more pain, and adrenaline can also stop the labor pain. So if you want the labor to progress normally, allow the mother to be comfortable, give her good music, let there be a birth companion, there should be dimming of light, there should be complete privacy, and the mother should be walking during the second stage and not lying down. So I have built this labor room in a tribal place in Gujarat, and you can see the sister, she is doing this in Vadodara. They don't cut the cord till the child comes out, and this gives them. Incidentally, Sister Bhanu, which you can see on a photograph, has been awarded the Florence Nightingale Award of this year as a nursing staff. So you can see there is a rope, and the mother can walk with this rope all around the room. She doesn't require a support, so she's not lying down always, and there is a mat for a birth companion. The zero separation is very important, and this is a video which has been cut into that. If you just allow the baby to be there on the mother's abdomen, what does the baby do? So first of all, it was very angry, then it stills down, then it gradually moves, it searches the breast, it searches the nipple, and starts sucking. No one told him, where is the breast, where is the nipple? That's what the baby can do by itself. And this is what is known as the zero interference. This can improve cognition. This can improve more breastfeeding. This can improve less chances of secondary problems and neurobehavioral problems. So what have I told you? Avoid stress, improve oral hygiene, control blood sugar, talk to your baby during pregnancy, and the micronutrients. Don't eat for two, but allow your food to have plenty of fruits and green vegetables and plenty of water. If you have some doubt, the government of India has got this book, Journey of First 1,000 Days. You can get more detail. Now, after the birth. So what are the things which are after the birth? Use a mustard pillow, exclusively breastfeeding, interacting with the child. Now, this interaction is after the birth. That interaction was before the birth. No body spray and no change in the style of the hair. So if the mother uses some body spray, the child will not go to the mother, because the baby's vision is very poor. He identifies the mother through the smell of the body and through the outline of the face, which is the hair. So if the hair outline is changed, then the baby will not identify the mother and will not go to the mother. So how does mustard pillow ensure better cognition? How does exclusive breastfeeding ensure better cognition? What is hammock, and what is protecting from string? It should be strong light and sound and no sweating. So before we begin, the government of India through our BSK program has said every child after birth should be looked for visible birth defects. So don't forget it. If there's a problem, you should attend to it immediately. Philosophically, you must understand that a term child, even if he's born 40 weeks, he is 9 months neurologically preterm, because his brain is still going to get formed. So you can see the calf walking on 4 legs, but for a newborn child to walk like a calf, it takes 9 months. The reason being that the neural migration, the neural myelination will take at least 9 months. So a newborn is born with only 25% of the brain, a chimpanzee is born with 45%, and a calf with 80%. So you can see these straight wires, they get connected as the mothers speak, and that's what is intelligence. At 6 months, so humans are born with remarkable underdeveloped brain, a curious state of affairs for the brain is. So to start with, human children have less brain but they develop very fast. So this extrauterine period is also important for the brain to form. And this is reflected in the slide that most of the sensory pathways, the language and higher cognition is developed in the first 12 months of the life. And how does it develop? When the mother looks at the child, these neurons and wires, they get connected. So when the mother speaks and the baby responds, and if there's toxic, the baby is crying too much, this derails the healthy development of the neurons. So what can we do? In the nursery, the children are kept flat. That's not a very good position. They should be either placed in a hammock, which is absolutely the shape of the uterus, and mother's sari, which carries the mother's smell, or should be like given to the father's chest, like a KMC. The babies can imitate. This is a beautiful experiment which was done with just a newborn baby, which was just born. So don't think that the babies have poor vision, but not so poor vision. So anything within 30 to 40 centimeter, they need to appreciate. That's their vision. Most of the eye doctors make a mistake. They test far off vision. In children, it's the near vision, which is equivalent to the cognition. Supporting the neck and the spine is very, very important. That's what the hammock did. That was the experiment we carried out. Sleep is very much important. So those who are parenting their children with TV on, speaking loudly, are actually taking away the intelligence of the child, because this formation of neural synapses and growth is very much ruined. So a newborn requires about 17 to 18 hours of sleep. This is known as sleep cycling. And during this sleep cycle, his brain is getting formed. So when you keep a child in incubators, they don't have cycled sleep. What does sleep cycling means? Moving from REM to NREM, and REM they send to. So these are some of the studies which were done, the importance of the sleep, and especially the rapid eye movement sleep. And so we are not trying to say that the mother should be with the fetus during the sleep and sleep cycle. The infant vision is very poor. As you can see, the newborn cannot see any outline. At 4 weeks, it sees some outline. And so don't give a very detailed toy. If you start showing very detailed toy, the newborn doesn't see anything, because the brain cannot process the detailed information of a face. So you should give toys whichever is simple to look at. Giving a mustard is very, very important, because this prevents plagiocephaly. In the West now, they give helmets, which you have to tighten the screw to make the head round. And if the head is not round, it can impact the IQ. So this is a hammock, which I calculated that it's giving you the same shape as that of a mother's womb. When the mother talks to the child, it's the left side of the brain is formed. And when others speak, it is the right side of the brain. What does that mean? That means that the child already knows the mother's talk even before he is born. And so it's very, very important to keep the baby with the mother. It's very difficult as the child is growing. Don't use walkers. Walkers tend to cause accidents. Walkers have been banned, but we have our own Indian walkers. But much before this, this is a Jamini Roy painting showing how cognition and safety of the child is held, because there's an eye contact, the mother is singing, the mother is swinging, all this is there. The use of thumb. So the child newborn, when he's born, he cannot use his thumb. So he uses a thumb. In Kerala, when you call it Vidya Prarambam, and in India, you call it Hathikodi. That means for the first time, the thumb goes inside it, and that's the mark of a civilization of a human being. So babies are born like monkeys, but at 9 months, what is the pincergraphs? That is what when they come in. So we need to learn, and these are the paintings of a very famous painter from South, Raja Ravi Verma, who has shown that when you are breastfeeding, you should not feel ashamed. You can see in the painting, there is someone to help the mother, but you help the mother, but the child has to be with the mother. So we tend to give the child after birth to someone in our family to take care. That's wrong. You rather feed the mother rather than holding the newborn. How to hold the newborn? This position actually helps the baby to develop stronger hips. And this is a very, very important that the mother and the baby looks in the same direction and not the American way where the baby looks to the mother's chest. So this actually allows better cognition for the child. Now, if you don't do all this, what is going to happen? So this was a very important study done in conjoined twins. You find a lot of areas where the brain didn't develop. So these are the black areas I call the black holes. So it's not a drug, it's not a tablet. It is just that you know how to raise a child, tends to improve. Don't give your child too many of toy guns. This leads to violence in the society. But if you give a duck with a baby duck, the child will consider about a family. So what kind of toys is very important. Now, the messages is exclusively breastfeeding and weaning at 6 months. Interact with the child, do storytelling, avoid TV, smartphone, and computer till the age of 3 years. And between 3 to 6, it should be only 1 hour, that too with adult to be around with. Avoid walkers. Weaning food should be colorful. So this is very important, the breast milk. Now, most mothers would say, my child is hungry because I'm not getting enough milk. What you need to be told that the child's stomach on day 1 is just the size of a grape. So you actually, the nature has made it in that way that it doesn't require too much of milk. At best, 1 teaspoonful of milk. So, and as the milk increases, so also the stomach size increases. So this is something wonderful that how nature has projected it as the mother's milk. So on day 1, someone may think, ये तो 1 चम्मच दूध है, इससे मेरे बच्चे का पेट क्या भरेगा? And they go to doctors and doctors then feed them. And one of the commonest reasons of death in a newborn is overfeeding, what we call the aspiration. So it's much better that if the baby is conscious, that he feeds directly to the mother. And the message is, you just require the day 1, it's size of a grape. And to teach this to the people, this has been that how much milk at one go is produced by the mother. And that's the size of the stomach, which can take, it can't take more than that. So food for the brain starts with food for the small tummies. Now the food which we give, I find a lot of people giving lactogen, lactodex. I have nothing against them excepting the main factor that they are all white. And the child's brain first eats, your senses eat, and then you eat. So the coffee in front of me, I saw it, how it looks like, I smelled it, and then I felt how to desire to eat it. And our hands are like forks. So the Indian tradition, when they put the hand into the food, they actually know how the food would be tasting. So these are something which is very important. And a newborn can differentiate between sweet, sour, and bitter. So this is, as the child is growing, please understand that it is not enough that you are preparing a food. It should be colorfully plated. If you do not know, please learn from the hotel industry. They know how to serve the food, because if people eat more, that's more money to the hotel. Now, the globalization of the economics has done some incredible mistakes. So you can see this is in Brazil, where sometimes back the American president wanted to fence it out. This is Jimmy Smith, and he says, home cooking, but you're finding Coca-Cola. Now, such highly sugarated drinks actually are very, very addictive for the children. And so the weaning, and if you read the MCP card, it's very clearly written, don't wean with something sweet. Don't give salty. Just give green vegetables, which are bitter. The child will spit, but you need to practice and give it there. But this sugarated drinks, one gets addicted. And I know my colleagues in hospitals love these drinks, but they neither give any value to the farmer, nor they give any value to your this thing. They are just highly. So one glass of this sugarated drink may have 20 teaspoonful of white sugar. Telling stories is very important. And, you know, Maria Montessori was a doctor and not an educationist. And she said, do not tell them how to do it. Show them how to do it and do not say a word. If you tell them, they will watch your lips move. If you show them, they'll want to do it for themselves. So the most important period of life is not the age of university studies, but the first period. And Einstein said, if you want your children to be intelligent, read them fairy tales. If you want them to be more intelligent, read them more fairy tales. And this was also told by our own J.C. Bose, who incidentally became the first person to be elected as the Fellow of the Royal College of Society. So when the reporter asked him, he thought that he had studied at Oxford and Cambridge, and J.C. Bose would say, I've studied at Oxford and Cambridge, and would name some professor there, which has allowed him to become a member of the Royal College of Society. Or at least he would say, I've studied in St. Xavier schools in Calcutta. But what he said was that I went to a village school under the open sky next to the Padma River or Padda River, which is a tributary of Ganges. My father, who was a district collector, he told me to study there. And on my right side was a son of a boatsman, and the other was a son of a Muslim orderly or a fisherman. And they used to tell me stories, so many stories that they made me the scientist. So this is statement, what happens if you take a rich magistrate's son and make him learn in a village school, sitting beside the son of servants and fishermen. So I think this divide which we have created actually has taken away the cultivation. And these are some of the photographs of how he was studying in the village Patshala. So when I went to the Bangladesh, I got some photographs from where, and you see, here is a person who not only invented radio, but he also invented the crystallograph, which is about. So my only thing is, how do children learn? You should need to understand. The children before 6 months, when he's shown a toy and the toy is removed, he doesn't track the toy. But after 9 months, he will search for the toy. And that's the time a scientist in a child is born. So allow him to search rather than teach him how to search. Let him discover, let him explore. And these all toys are there. You don't make very fanciful toys. In India, we could produce toys which didn't have lead paint, with textures which could be taken to mouth. And these are family toys, social toys. So they relate to the family, they relate to, and these are not like guns and He-Man and whatnot. And these are some of the research we found, how children's toys are there. Now, this is an MCP card. If you want to rise, please use this. The green one tells you what the child does at that particular age. And the violet one tells you what the parents need to do. And if there's a problem, that's the red one. So by using this, broadly speaking, we can understand the child's development is proper or not. And if it's not proper, you can go to this early intervention center, which is a part of RBSK. So I will not take it much long. So that's okay. Thank you.
So thank you very much, in fact, Professor Arun Singh. And my request, since I've been 700 odd, there are messengers, I would say, who are connected. Whatever the practical tips, in fact, every time when I hear, I learn something new from him. And take these messages to your, in fact, other than your professional life. If you are working in a hospital, obviously, you will do much better for the nation building, for building the communities, and for building the families. If these small things, whether a newly married couple has walked into your hospital, or somebody who has come with a small child at different stages, like his message was very clear for everybody to do something. So kindly make it a point that whether you are a care provider or you are responsible for managing the programs, or you are responsible for counseling, do touch upon whatever Professor Arun Singh has highlighted, because that would do a larger good, and it would also prevent so much of the, in fact, mortality, if I talk in that sense, and our, say, future generation, our children, they would be much more intelligent, robust, and emotionally stable. So this is the message after the today's session, which I'm just re-articulating, which I mean our eminent Dr. Arun Singh has conveyed, and practicing becomes more important. Otherwise, it becomes one of the theory gyan, where we come, we hear, and we go back. I've asked Dr. Sushant Agarwal, requested him, and our IT executive, Mr. Mukesh Kumar, to put the presentation on daily basis after, whatever the procedure is required, so that you are able to connect, you can go through, and that would be extremely helpful. So with these many words, I want to thank once again our eminent speaker, and thank you all of you. 700 odd people being on a Sunday afternoon, being connected with us is really a source of encouragement to us, to the team sitting over here, and to the team who are there at the different places. Thank you very much indeed.
मैं ज़्यादा सर हॉस्पिटल